Hey everyone, welcome to your A-level review. For all my A-level psychology students out there, you know there's one thing that can make or break your exam performance: nailing those clinical psychology studies. It's not just about memorizing names and dates. The A-level exam wants to see that you can apply this knowledge, critically analyze research, and understand the nuances of each study. Think of it less like rote memorization and more like building a toolkit for understanding human behavior. Now, Paper 3 is all about applying your knowledge. You might need to describe a study, evaluate its strengths and weaknesses, or even apply a treatment method to a hypothetical scenario. That's where really understanding these studies comes in handy. But Paper 4? That's where things get really interesting. This paper wants you to go beyond just describing. It wants you to think critically. Compare different therapeutic approaches, analyze ethical considerations, and even suggest improvements to the studies themselves. So how do we tackle this beast of an exam section? Well, today, we're going to break down 5 key studies from the clinical psychology option. We'll dissect each one, looking at the aims, methods, findings, strengths, weaknesses, and crucially, how you can use this information to smash those Paper 3 and Paper 4 questions. Let's get started. Let's dive into genetics with Oruc et al. 1997 study on bipolar disorder. This research explored how genes might influence bipolar disorder, a condition marked by dramatic mood swings. Oruc and the team used a classic twin study, comparing identical and fraternal twins. Identical twins share all their genes, while fraternal twins share about half. If genes matter, identical twins should show higher concordance rates for bipolar disorder. And that's what they found: a much higher rate in identical twins, suggesting a strong genetic link. But genes aren't everything. Environmental factors like stress also play a role. For your exam, think about comparing this genetic study with research on environmental triggers, or consider the ethics of genetic testing. Next up, we're stepping into the world of virtual reality with Freeman et al. 2003 groundbreaking study. This study shows how innovative technology can help us understand complex psychological phenomena. Imagine using VR to safely study persecutory ideation, the belief that others are trying to harm you. Freeman and the team created a realistic virtual library, told there were people in the room, and asked what they may be thinking about the participants, with no history of mental illness, were immersed and asked to report their experiences. Those without persecutory ideation in real life experienced paranoid thoughts in VR simulation. This suggests VR could be a powerful tool for assessing and understanding paranoid thoughts safely. It also opens doors for new treatment approaches, like exposure therapy in a virtual world. But remember, VR tech can be expensive and isn't the same as real life. For your A-level exam, compare this to traditional methods like interviews or questionnaires. Let's move on to a study that explores the often misunderstood world of addiction with Grant et al. 2008 research on treating pathological gambling. This study focuses on the use of opiate antagonist as a treatment for pathological gambling. Researchers hypothesized that a family history of alcoholism and stronger urges of gambling would be associated with more positive outcomes. You see, pathological gambling, much like substance addiction, can have devastating consequences on individuals and their families. Grant and his team already knew that opiate antagonist shows positive results for those with alcoholism and decided to see if it would work for those suffering from pathological gambling. There were 2 double-blind placebo clinical trials. Participants were randomly assigned to one of 4 groups. Group 1 was a placebo group, and those receiving nalmefene doses in 25, 50, or 100 milligrams per day. Group 2 was a placebo, and those receiving naltrexone in doses of 50, 100 and 150 milligrams per day. The main unit of measure was the Yale-Brown Obsessive-Compulsive Scale, modified for pathological gambling. This is a clinician-administered scale to assess gambling severity by assessing symptoms over the previous 7 days. Semi-structured interviews were used to gather family history, and the study's findings offered a glimmer of hope for those struggling with pathological gambling. The treatment group showed a significant reduction in their gambling behavior compared to the placebo group, both at the end of the treatment and even at a follow-up assessment. Treatment response was defined as at least 35% reduction on the Yale-Brown Obsessive-Compulsive Scale. The results showed that the treatment was most effective for those who showed a family history of alcoholism. This study shows application to everyday life by showing the effectiveness of opiates in treating individuals with gambling disorders. However, with an experiment involving placebos, there are ethical issues around deceiving participants we have to take into consideration. For your A-level exam, think about comparing this study to other treatment approaches for addiction, such as medication or motivational interviewing. You could also discuss the ethical considerations surrounding gambling addiction and the responsibility of healthcare providers. Now let's face our fears. Literally, with Chapman and Delap's 2014 study on treating blood injection injury, or BII, phobia. This phobia, characterized by an intense fear of blood, injury, or medical procedures, can be incredibly debilitating, often leading to avoidance of necessary medical care. Chapman and Delap wanted to compare the effectiveness of two different treatment approaches for BII phobia: applied tension and systematic desensitization. Applied tension involves tensing and releasing different muscle groups to increase blood pressure, preventing fainting, which is a common response in BII phobia. Systematic desensitization, on the other hand, is all about gradually exposing individuals to the feared stimulus, in this case, blood or injury-related images, while teaching them relaxation techniques. The researchers recruited individuals with BII phobia and randomly assigned them to either the applied tension group or the systematic desensitization group. Both groups underwent a series of sessions tailored to their assigned treatment approach. The results? Both treatments showed promise. Both the applied tension and systematic desensitization groups demonstrated significant reductions in their fear and avoidance behaviors related to BII stimuli. However, systematic desensitization appeared to have a slight edge in terms of long-term effectiveness. This study highlights that there's often no one-size-fits-all approach to treatment, and that different methods can be effective for different individuals. When preparing for your AIICE exam, consider comparing and contrasting these two treatment approaches. What are the theoretical underpinnings of each method? What are the potential advantages and disadvantages of each? How might you tailor the treatment to an individual's specific needs and preferences? Finally, let's talk about accessibility in mental health care with Lovell et al. 2006 study on using telephone-delivered cognitive behavioral therapy, or CBT, to treat obsessive-compulsive disorder, commonly known as OCD. This study challenges the traditional face-to-face model of therapy and explores innovative ways to make treatment more accessible. Lovell and the team wanted to determine if CBT delivered over the phone could be as effective as traditional face-to-face CBT in treating OCD, a disorder characterized by intrusive thoughts or obsessions and repetitive behaviors or compulsions. They recruited individuals with OCD and randomly assigned them to one of two groups, one receiving CBT over the phone and the other receiving face-to-face CBT. Both groups received the same CBT protocol, focusing on challenging and modifying the thoughts and behaviors associated with OCD. The findings? Get this. There was no significant difference in treatment outcomes between the two groups. Both the telephone-delivered CBT and the face-to-face CBT groups showed significant reductions in OCD symptoms. This study has huge implications for the future of mental health care. It suggests that telephone-delivered therapy can be a viable and effective alternative to traditional therapy, especially for individuals who may face barriers to accessing in-person treatment, such as geographical location, mobility issues, or even stigma. However, it's important to note that this study focused on a specific disorder, OCD, and the findings may not be generalizable to all mental health conditions. For your AICE exam, think about the broader implications of this study. How does technology impact access to mental health care? What are the ethical considerations of delivering therapy remotely? How might you adapt therapeutic techniques for different modes of delivery? So there you have it, a breakdown of 5 key studies from the AICE Psychology Clinical Option. Remember guys, success in AICE Psychology isn't about memorizing facts. It's about applying your knowledge and thinking critically. In Paper 3, you might be asked to describe, evaluate, or apply a study or treatment method. Focus on using the studies as evidence. Use the P method, point, example, explanation. For instance, you could make a point about the effectiveness of CBT, then use Grant et al. A study as your example, explaining how their findings support your point. In paper 4, you're expected to go beyond describing. Think critically. Compare methods, suggest ethical improvements, and practice mini evaluations of all 5 studies. For example, you could compare the ethical considerations of Oruc et al.'s genetic study to those of Freeman et al.'s virtual reality research. Let's test your memory with 3 quick questions. Which study used virtual reality to assess persecutory ideation? What treatment was tested in Grant et al.'s study on gambling? Which study found no significant difference between telephone and in-person therapy? Pause now to answer. Answers will appear on screen in 5 seconds. Final tip: link your answers to real-life application and always show critical thinking. Comment below with which study you find easiest or most difficult to remember.